Hello, it's Dr. Elizabeth Alter. Do you still have questions about your eye health? The eyes are so important. Obviously, when something goes wrong with our eyes, we're very worried because our our vision is just crucial to our function. And some things can again be very scary when they happen to our eyes. So, one of the things that I always caution patients about is when they wear contact lenses. Always patients that wear contact lenses are higher risk patients in terms of their eye health because they have a foreign body, namely this piece of plastic that they see through. So there's a from a functional medicine perspective, there's a lot of issues that stem from that. Number one, having a foreign body in your eye. And number two, all the chemicals that it takes, whether it's your solutions to disinfect your eye, then some patients use drops to keep their contact lenses lubricated, and and obviously the worst thing that a contact lens user can do is leave their contact lens in overnight. I know that some contacts are designed that way, but even when they are, I tell my patients that it's important for your eye to get some rest, especially as you sleep. So it's important to take those out. Now, if you wear contacts and you get an infection, that's really important that you understand that you must throw away your contact lenses. Um, Obviously, some are more expensive than others, and some patients really want to try to salvage them. But really, I my advice to you is to not risk it because it's just it'll be worse in terms of an infection. So because the bacteria that grow when a patient wears contact lenses are different from patients that don't wear contact lenses. So if you have an eye infection, of course, always be evaluated by a doctor like myself or your optometrist or go to an urgent care. But sometimes, and actually, I would say a good percentage of the time, the conjunctivitis, which is the umbrella term for inflammation and or infection of the eye, can resolve on its own. But that's up to the the person evaluating you. Sometimes, depending on the situation, I will give the patient very clear instructions to know what to look for in terms of seeing if their eye infection is getting better or not. But in general, you want to try to keep your immune system up. A lot of times, the reason why we get eye infections is because our immune system isn't well equipped to fight the infection. And so we are susceptible and we get um, these infections. So remember to keep up with your probiotics, your vitamin C to maintain your eye health as well as your immune health, and have a healthy day.